To start off with, we've got Winston Lahaye, who we know well, who was in a previous incarnation a general practitioner with JDF, and then decided possibly he wanted to make a bit more money, I don't know, or probably not in psychiatry, and moved on to psychiatry, which to us has been very helpful because we always feel good when there's a consultant who is on our side of the fence and understands us. It really does help. Dr. Lahaye is a lecturer, as we all know, at the University of the West Indies Hospital and Department of Community Medicine and Psychiatry, and he did a fellowship in drug abuse at Johns Hopkins University. Without further ado, over to him.
Thank you very much, Mary. Morning, colleagues. Must say it's a pleasure to be here talking with you this morning. When your conference is so well organized that people are informed for 3 and 4 months prior to, and it's very easy to cancel other things, having made a commitment to come here this morning. The topic this morning, substance use and misuse, and I must congratulate you on the title of your conference. We hardly see this, and so people like Amza and myself are happy to come when we see a conference dedicated to brain and behavior. Substance misuse, and I'll just go through, so just to get us all on the same page, get some definitions out of the way real quickly, and then go into a general overview to include available treatments in this field. It's pervasive throughout the world, creating an enormous burden on healthcare systems, especially third world healthcare systems like ours, strapped for cash, and especially when they introduce a no user fee policy on top of that. Deaths, the illnesses, the disabilities seen from substance-related disorders are far more than from any other preventable health condition. A very good example for this group would be the issues associated with tobacco use, which surpasses HIV-related illnesses, diabetes-related illnesses, cardiovascular disease associated disorders, all added together. 1 in every 2 cigarette smoker will die from a tobacco-related condition. And we could use alcohol and cannabis and others as well. We know the relationship between drug use and crime, especially in countries like ours in the Caribbean, between drug use and the acquisition and transmission of STIs to include HIV, AIDS. And all this certainly points to the fact that substance misuse is a major public health problem. So this isn't one of those where you sit in your home, in the safety of your home, thinking, I am fine, I'm not a drug abuser. It's a problem that impacts us significantly at the level of public health for the country. More importantly, disadvantaged groups are disproportionately affected. A very good example of that would be the issues around children, adolescents, of particular concern in all countries throughout the world, including Jamaica. The fact that young users start earlier, have more time to develop these problems, and of course are at greater network risk for the acquisition and transmission of STIs. The fact that adolescence is a period of transmission is the main reason that adolescents are so at risk in terms of their cognitive, attitudinal personality, and of course, out of their control genetic issues associated with their development. More specifically in our country, the Caribbean in general, the experimentation and recreational use of cannabis, a major issue. And that's my first plug against any thought of decriminalizing, let alone legalizing cannabis in any country. Who are those at risk? Anyone with a comorbid psychiatric disorder, be that schizophrenia, depression, etc. Those with a history of aggressive and antisocial behavior, school dropouts, children of substance abusing parents, the physically handicapped, abused or neglected persons, pregnant mothers, and of course, most importantly, for almost everything in psychiatry, those from a lower socioeconomic group. The whole issue of drug abuse as it stands now, I'll go on real quickly to show you that effective March next year, we're doing away with the need to differentiate abuse from dependence and just use a very simple term, misuse. But as it stands, drug use is self-explanatory. You use or you don't use. You start abusing when, by virtue of the frequency of your use or the amount that you're using of whatever the substance is, you start having some dysfunction, whether physical, social, and or occupational dysfunction. So that indicates that you're now having a problem. And the scientific definition, we name 4 things. that you need any one of. And we don't need to get into this, especially since we're adjusting it effective March next year. Dependence, on the other hand, would be associated with any 3 of 7 criteria that we list, and we list a period that you need to be doing this for, which happens to be 1 year, and then the dysfunction in 1 or more of the 3 spheres of functioning. As I pointed out, and that's the list there, very important, we've highlighted the behavioral things in yellow from 3 to 7. And so the measurable things, tolerance and withdrawal, objective things which can be measured, are 1 and 2 above. The difficult things to treat would be the behavior-associated issues. And so management really is about changing lifestyle in order to achieve sobriety. Very, very difficult to maintain and sustain. The new term, effective March 2012, will be substance use disorders based on the DSM-5. We now use the DSM-4 TR. That's a Diagnostic Statistical Manual of Mental Diseases, the 5th revision, effective March next year. And some synonyms then would include whether abuse or dependence. I'll give you the real, very logical reason for that. If I am diagnosed with alcohol abuse and I'm not dependent, equally I can get intoxicated and mow down 10 people waiting at a bus stop, leading to deaths, including my own, just as if I am dependent. And so it really doesn't make a major difference if I am abusing or dependent. That's the main reason they adjusted this. Some synonyms would be problem drug use or substance misuse, which is the term which will be used effective March next year. So you have substance use and substance misuse. Substance misuse is a biobehavioral disorder which certainly results from the integration of biologically mediated issues along with behavior changes, maladaptive usually, and of course all that in a social context leading to the whole issue of substance misuse. This isn't just an issue associated with the misusers, but we must accept some societal responsibility. And really this is just a first plug to show that it's not just about them, but it's about all of us. Degree of access to drugs, both legal and illicit, we must take some responsibility for that. And so when you have groups lobbying to decriminalize cannabis, then certainly that just can't be the way to go, given the issues we already have with alcohol and tobacco. Sociocultural degree of tolerance in our country, especially as it relates to cannabis use, creates a major cause for concern. Clear behavioral ideals or norms, or the absence of. Many of our youngsters have no clue what's acceptable behavior, what isn't. If you on top of that now infuse drug-related issues, then you're really poised for disaster. There's a triangulation of model of infectious diseases, which you all know can't have an infection unless you have an agent, a vector to take that agent to a host to then infect the person. Similarly, there's a triangulation model of substance misuse where you must have a user to be misusing. Eventually, you must have the drug for them to use, and of course, the environment facilitating that drug use, all culminating in substance misuse. Just mnemonic that you'll see as you go through the literature: ATOD, alcohol, tobacco, and other drugs, or ATID, alcohol, tobacco, and illicit drugs, allowing for the separation of alcohol and tobacco because they are legal from the other drugs, but they are by no means create less an impact than the illegal drugs, just so we're mindful of that. Some common substances, and we separate them into different groups by virtue of their impact on your system. Some substances appear in more than one group. Hallucinogens lead to hallucinations, cannabis, the big guy there, stimulants, stimulate, and so on. There's a 5th group I must mention, not there because it's by virtue of the makeup of the compounds, and those are inhalants. Petrol, shoe polish, nail polish remover. Major problem, especially for adolescents who sniff glue. Paste the glue on the inside of plastic bags, put that over their faces, and then suffocate by virtue of the high they're experiencing, oblivious to the fact that they're not breathing properly. Major problem in places like Nepal, India, but we have had a few of those as well. So the problems resulting from substance misuse are not just personal, but there are public health problems. Families are also affected if individuals are affected. The society is affected, and of course, by virtue of that, economic impact. especially as you look at younger people who in 20 years' time should be the productive workforce of the country, then it certainly doesn't leave a lot for us to look forward to. The major issues that substance misuse is a chronic relapsing disorder, which is characterized by a pattern of using, you stop a little for varying periods, and then you relapse, where unfortunately, unlike most other illnesses, relapse is the norm, not the exception. So most people will relapse. However, very important to recognize that without treatment, there is almost no chance of recovery. And so individuals must engage in treatment in order to have a chance to become well.